The forehead, so our patient has a very nice forehead. We look at the temples, which are also very nice, full temples. Then we look at the mid face, we look at the chin, and we can see that our patient doesn't have any problem with volume. And then we look at the ptosis, so we look at the facial shape, and we can see that oval is okay, but our patient has a little bit pre-jawling, yes, a little bit of pre-jawling and here. So you would benefit from lipolytics, right, and some other treatments like that. But I want to say that we need to choose the product carefully for patients who have this jawling and little bit of heaviness in the lower face. We need to decide which product to take, because if we inject Angelica with right?
Florence.
Sorry.
Angelica is the name.
Sorry, Florence. If we inject you with the Jalupro HMW, then she can be swollen up in this area for like 1 week or more, especially knowing that she did the toxin before, because the major muscle is blocked and it doesn't drain the areas. Orbital rim. I tried to palpate it. Here it is. It ends here, so you have very good bone structure, which is very good. You will not age as quickly as others, yes, and you have very good thick skin. We can also check if the patient has the symptom of facial dysplasia by checking at the level of the zygomaticus ligament. We put our finger on it and then we lift it up and down, and we see the amplitude of our movement. If it moves 2-3 centimeters, it means that patient has facial dysplasia, and it means that we need to support the ligament. Here it is not that much movement, it's approximately 1 centimeter, which is a good result. And also we can look at other symptoms of dysplasia, such as stretch marks, such as blood vessels which are fragile. Usually patients with facial dysplasia have myopia because the ligament in their eye doesn't work. They can have heart problems, and also they can have bruises from any procedures. So there can be a mild dysplasia because of the blood, right, or because of the rosacea and telangiectasia, but that's it. And we can also check the this platysma auricular fascia, so we kind of pull the skin and also see at the amplitude of the movement, and we can see here that also the quality is very good and the ligament and fascia is very firm. Okay, let's talk about our marking. So we draw the orbital rim. Then we draw the horizontal line from the lateral canthus. And then we can even palpate with our finger and try to find out the lateral orbital thickening. You can find it in yourself, and we can feel it as a like elevation of tissue which is more firm than other parts. Then we, can I turn your head to the side? Okay, then we find the 2 other points that are facial, that are auricular platysmal fascia. So I outline the jaw angle, and then 1 second dot will be in front, right in front of the tragus. And then 1 more point will be right on the jawline angle. So we cover the auricular platysmal fascia. Then we ask Florence to clench teeth. Thank you. And we feel the masseter, and we can see here that masseter is strong, and it's a very strong muscle. And then we outline the, thank you, you can relax.
Talk too much, that's why it's strong.
Yeah, and this is one of the strongest muscles in our body because we use it to eat, to get food and to chew. So we can see here that this is the frontal edge of the masseter. And then how to find the zygomatic ligament. I kind of move upwards along this ligament and I feel the zygoma first, and then I can see that the skin, the pulling of the skin stops here because it is attached by the ligament. So here I can, I find the zygomatic ligament and which is McGregor patch. If you want to inject deeply on this point, don't inject right in this point, choose the point nearby, because usually right in this area, yes, we have the artery, and if we hit it, we will cause bruising. So usually here also the danger zone is the malar back, SUF, lateral SUF. We don't see much of it in Florence, but we need to avoid it, and I usually draw it for myself so that I don't inject in it. Usually it is, as we said today at our training, that each face is different and that we need to adjust the point to the face. So you can move a little bit these points.
You can go.
You can go more laterally, and you can go under the ligament more medially, or if the patient has, yes, if the patient has depression, we can go under the depression. Yes, like everything that comes medially to the pupillary line is a more dangerous zone, so I inject subcutaneously, more superficial. So okay, how many points we already found? 1, 2, 3, 4. Then we have 2 more basic points. One will be lower. This is the medial cheek septum or the mandibular ligament, and usually we can see the depression here, so I inject my 1 more point in the area of the depression. And many people, actually many markets, move this point. Some people do 2 points on the zygomatic ligament. As we saw Poland today, they do this point in the nasolabial fold. So this point is, you need to adjust it. Some people do it at the temporal septum area. Okay, and then we need to find only the mandibular ligament. So we can see here the mandibular fat pad. We don't inject in it, and we can inject just medially to mandibular, because if we inject in this fat pad, she will not benefit and it can swell. But if we inject here, we can even ask to do such kind of movement.
This is not DAO. No.
Yeah, this is the DAO is the muscle, the triangular muscle that goes, actually even it can go to the masseter even. It's very thin and it's very wide. But this is, I would say, where we see the depression, we know that there is a ligament somewhere. So this is the basic protocol, and then we can do 1 more dot either in the chin area if our patient needs to elongation of the chin and needs immediate effect. Why also we have the point of the chin? It is because if we inject the lateral points and the medial ones, we can also kind of stretch,
shape the face.
Yes, shape the face, and it gives the immediate effect to our patient. In case of Florence, I would also do, even though it is basic protocol, but I would do a small injection near the temporal septum to just to improve the skin quality here and lift a little bit the eyebrow. So you don't have to completely wipe the mark, but you don't inject in the mark, not to tattoo it, you know, into the skin. So you can inject nearby. Okay. Sometimes I scratch the skin like this with 1 finger because it distracts.
Yeah.
Distracts from the injection. And then I go approximately 4 millimeters deep. And then I inject the bolus of the product, 0.2 approximately, yes. But here I do a little bit less because I have one more point in the temporal septum. Okay, then I do the dot in front of the tragus. So 1.2, this is the second dot.
Not deep here, yes?
This is superficial also because here subdermal because these ligaments are very superficial. And then on the
No, it was intradermal.
here
In the dermis. Subdermal would be sub-Q. The rest of the injections would be sub-Q, isn't it?
no,
I think subdermal.
subdermal.
Yeah.
Subdermal.
It will show like
It show like a
benching.
papule, yeah. Then, okay, this is 1, 2, 3 injections. We need to do 4, 5, 6, and a little bit here.
And 8 here too.
Yeah. Okay, so now we will do the zygomatic one. We can do it either deep on the bone. Here, in case of Florence, I don't want also to lose the product because her ligament is very firm. I want to improve the skin quality more. So I will inject also subdermally. Product goes super easy with this 27 gauge needle, and I need to be careful.
How are you, Florence?
Absolutely fine.
Okay.
I only know she's done
You're a great
3 now because you said it. Otherwise, I'd be like, what are you doing?
Yes, so now we do in the medial cheek septum, also to improve skin quality, to decrease the depression, and also each of these boluses will spread like 2 centimeters from this area, or even 3, and you can see that the product is beautifully spreading in the skin. Okay, now we will do the mandibular ligament.
Well, can you actually see it going in? You can all see the product.
Yes, we can see that it's now
You're all
we have
magicians.
some product left, so we will do the. Here we need to be aware of the superficial veins. You can see them very well on my face because I have very thin skin. And if you inject in the superficial vein, you will not have any problem, but you will have just a bruise, a very bad bruise. So I'll try to look carefully to see. Yes, I can see them. Okay. And I have just 0.1 for the chin.